Hi, my name's Nicola Chicken and I'm a project manager at Yorkshire and Humber Academic Health Science Network, or AHSN. This short video aims to give you an overview of benefits realisation with a particular focus on lessons learned from our recent NHSX commissioned remote monitoring programme. So what are benefits? In short, benefits are the measurable improvement resulting from an outcome seen as advantageous by stakeholders where value is created. And examples include shorter length of stay, improved quality of life, improved staff experience and well-being, or a reduction in costs. Why are benefits and the benefits realisation process important? So they provide an evidence-based demonstration of the impact of your project. They act as assurance of the investment of funding and resources in your project. They can be used to engage stakeholders in your project. They help to track progress throughout the project. They help to build the case for sustainability and adoption as business as usual. And they provide tangible results that can be included in case studies to share and spread your successes for further adoption. There are many different types of benefits that you could measure as part of your project, and some of these include cash releasing benefits, so those which bring revenue or reduce costs. Non-cash releasing benefits, so those which provide an improved input to output ratio, such as doing more with the same or doing the same with less. Qualitative benefits, those which provide quantifiable value but cannot be monetized. And societal benefits, so those which provide benefit to individuals, communities, societies and national economies, and that includes environmental benefits. As mentioned at the start of this video and as covered in our initial blog, over the last 2 years at Yorkshire and Humber AHSN, we ran a remote monitoring programme commissioned by NHSX, which came to an end at the end of June 2022. This programme began as a rapid response to COVID-19 and evolved into more of a spread and adoption piece across numerous pathways in primary care, acute trusts, hospitals, emergency departments and the care sector. A benefits plan was written at the beginning of the programme, capturing the anticipated benefits that the projects would provide. However, the scale and complexity of the programme quickly evolved in terms of numbers of providers we were working with, range of pathways and services, and range of patient cohorts. So we soon found that a refresh of the initial benefits plan was needed to ensure that we were fully capturing and demonstrating the benefits we were seeing from our range of projects. In terms of data capture, for some of our benefits, we were relying on clinicians completing a short series of questions after a consultation, but these questions weren't mandatory, so we found that we had incomplete data in some places. So we undertook an exercise around what reasonable assumptions and scaling up of data could be done to account for this incomplete data. We definitely went on a bit of a journey with our benefits measurement and realisation, and we wanted to share some of the lessons that we learned and things to consider. So I would say try to scope benefits as early in the project as possible. Now, it may not be possible to completely nail down each benefit in low-level detail, but linking anticipated benefits into your goals and objectives really helps to set a good foundation. But while it's good to start as early as possible, do ensure that you consider flexibility for change. So as I mentioned on our programme, we had to review and revise our benefits throughout the programme, so it's good to consider that this could be a possibility from the start. Data is a really important part of benefits to ensure that your benefits are measurable and tangible. So as early as possible in the project, try to identify data sources for baselining. Baselining means that you'll be able to show the picture before your project and measure the impact of your project against this. Similarly, if any of your benefits have a monetary or cost aspect, try to identify the sources of data for these costs as early as possible. There are various open sources available for this, such as the Personal Social Services Research Unit, which is a database for unit costs of health and social care, and the National Cost Collection, which consists of the average unit cost of providing defined services to NHS patients in England and patient level costs. Try to have clearly defined metrics and methods of measuring. Have a plan for what data needs to be collected, how you're going to collect it, which stakeholders need to be involved, who's going to analyse it, and whether there's any potential for incomplete data from your method. Map out the timescales needed for the benefits measurement process, including building any resources such as surveys, communicating with the relevant stakeholders, allowing sufficient time for data collection, and building in regular review points in the timescales. Make sure that you include sufficient time for assessing results. And if you do find, as we did, that you have incomplete data, you can use reasonable logical assumptions and scaling up to ensure that you're demonstrating as full a picture of the benefits as possible. We wanted to share some existing resources that we found really useful on our programme. The Innovation Collaborative have a future NHS workspace that contains a wealth of resources and information, and we'd really recommend checking that out. This includes a range of resources such as lots of easy to follow written guides on topics including identifying benefits, measuring for improvement, data sources, and calculating return on investment. And it also includes recordings and slides from masterclasses and events. We will be continuing to release more resources on remote monitoring and virtuals in the coming months on our website, which is www.yhahsn.org.uk. And please ensure that you're following us on social media to keep you updated. We hope that you found this useful. Please feel free to contact me with any queries, comments or feedback on nicola.chicken@yhahsn.com. Thank you for watching.